Some 210,000, to be specific, 211,550 people have returned to Australia through hotel quarantine arrangements since the 31st of March last year. 211,500. Now, there have been a number of cases, in the handful of cases, that have resulted in those quarantine arrangements not always being 100% perfect. But one of the things that have characterised our response to the pandemic is that we have been proportionate. We have understood the context. We have sought to calibrate what is a reasonable risk that we have to manage. To give you an understanding of the difference in the risk situation Australia is facing to overseas, last month 30,000 people died in the UK because of COVID. In Australia, no one did. And so I think we've got to get a bit of perspective on the challenges that we're facing. Our hotel quarantine arrangement, which was what was agreed at National Cabinet as the most effective way to ensure that we could continue to receive Australian residents coming home to this country and enable the public health orders that state governments have put in place regarding quarantine, very sensible public health orders, that was the most effective way of meeting those objectives of public health, but also ensuring that Australia could continue to function. Now, the Commonwealth has put in place, at some significant cost, some $243.7 million for the provision of COVID quarantine arrangements at the Howard Springs quarantine facility for organised national repatriations of Australians. We did that last October. Now we're working on that having a capacity of 850. And the Commonwealth is open where there are good proposals, very comprehensive proposals, where that supplementary capacity to deal with emergency situations or indeed the repatriation flights that we ourselves have organised for those other facilities to be used rather than having to draw on the hotel quarantine arrangement. But when we discussed this as a federal government and took the advice also from our agencies, whether it was Home Affairs or Health or others, it remains the case that the most effective way to deliver at the scale that Australia needs to deliver these arrangements, that hotel quarantine remains the most effective way to do that. And that remains the advice I have from my experts. And the alternative is not that clear to me. I mean, we could go and try and rebuild the Labor Party's immigration detention network that they put in place during the border protection crisis under their administration. And we all remember what a debacle that was. And so if that's the option, then I don't find that as persuasive. But when there are specific proposals, and we're working through one in Toowoomba at the moment, we're not working through it. We've looked at the Gladstone option and we don't believe that is a sensible thing to do. There wasn't a lot of detail on that, but the broader risks were not ones that we thought were ones that economically or particularly from a health point of view could be appropriately covered off. But the Toowoomba option we're looking at is a supplementary capacity, and writing back to the Queensland Premier today about that. But this idea that you can replace the hotel quarantine system, bring Australians back home, manage your health agenda effectively through some other mechanism, I think we have to keep a sense of realism about this and a sense of proportion. 211,500 people have come back. We've had a handful of cases that haven't been completely contained within that. But I can tell you what, if Europe achieved that, if the UK achieved that, if the United States had achieved that, they wouldn't be looking at the situation they're looking at now. They'd be looking potentially at the sort of situation that we as a nation have achieved. Greg? Greg, did you want to add to that?
Yeah, I will. Look, very briefly, as I mentioned, in a world of, the last 24 hours, 439,000 cases, there's a pandemic, and yet we have to keep a perspective. One community case, we just went through a period of 12 days with no community cases. The world looks on at Australia and says, how have you done this? And that perspective, I think, is very important because that translates to lives saved. And so long as there's a pandemic, and unless Australia were hermetically sealed, no Australians returning for funerals, for families, for work, no Australians returning for weddings or births, No Australians being able to go overseas with the expectation that they'd come back after meeting up with their own families. No trade, no wool, no wheat, no iron ore going abroad, no critical medicines or fundamental foods that weren't available in Australia coming in. That's the only way to hermetically seal Australia. And I'm not sure anybody is actually proposing that. In that situation, we have to be have to be aware as to how we bring people home. And that bringing Australians home is what we have to do, and to do that safely. And to think 211,000 Australians have come home through this system. Most days we're getting 0 cases. Sometimes there will be challenges, and anybody who says there won't be cases in Australia isn't understanding the nature of the pandemic. But if we do that, then what we've done has saved lives and protect lives, but we'll always work on continuous improvement.